Hello, welcome to ICOR's June webinar as we move through our resilience education program and help build resilient communities, one organization at a time. We're very excited today to be sharing with you hackers, hashtags, and health emergencies, and looking at, does your crisis communication plan reflect today's reality? We're really happy today to have our guest speaker, Suzanne Bernier. She is actually one of ICOR's instructors, and she teaches our crisis management and communications series for our certification program, as well as our crisis communication planner. She is a former journalist, and she is also an award-winning global crisis management consultant. She is a frequent speaker and author. She's helped governments, communities, and companies plan for, respond to, and or recover from disasters for over 20 years. You might want to check out her book, she's the author of Disaster Heroes, and this is where she has documented a lot of the heroes that turn up at natural disasters around the world and the role that they play in helping bringing their communities back. She was also named 2016's Continuity and Resilience Consultant of the Year in North America by the Business Continuity Institute, and had the honor of being a guest speaker at the White House during FEMA's 2016 Individual and Community Preparedness Awards ceremony. Our webinar today is we're going to take a look at reviewing crisis communications case studies, lessons learned, and recommendations to ensure that your organization can respond effectively to today's new risks and hazards. A recording of the webinar will be available in about 2 days on our webinar page. We say 2 days, but sometimes it's the same day. It just depends on how quickly we can get it up. If you have questions during the webinar, please use the questions button. I will do my best to respond to your questions during the webinar, and if we need to direct those directly at Suzanne during the webinar, I will go ahead and do that. Otherwise, we will take a look at them at the conclusion of the webinar, and if we do run out of time, she will respond to you by email after the webinar. Also remember that you will receive a certificate of attendance if you attend a minimum of 5 minutes. So we're going to start off with a short poll. She just really wants to know, does your organization have a crisis management or crisis communications plan, not to be confused with the crisis management plan? So this will run for about 10 seconds. So go ahead and answer this quickly. And it is always good to be honest. I see some of you actually saying, "I don't know," which is a good thing to be able to share. We have about 2 seconds left, and I will go ahead and close the poll. All right, and so Suzanne, we have about 66% of the people attending who, yes, they do have a crisis communication plan, 14% do not, and 20% are not sure. So at this time, I'm going to go ahead and let Suzanne take over.
Perfect. Thanks very much, Linda, and welcome everyone. I wanted to just thank you all for tuning in and listening in today, because I know that we're getting a little bit webinared out, aren't we, with a lot of these incredible pandemic and other webinars that are going on. So thank you all for taking the time out of your busy schedules to be able to listen into ours today. I wanted to share with you all a little bit of us thinking about, of course, now it's all about COVID-19. It's good to see that a lot of you have crisis communications plans in place, and hopefully those are to deal with anything that's happening. Of course, you're probably using them quite actively right now in responding to the pandemic. But I wanted to take this presentation and the time that we have today to talk about being aware of all of the other things, all of the other hazards and risks that are still out there as well, whether they're infectious disease or completely different, and wanted to focus on some of those today and help us remind how we need to be prepared, specifically on how we communicate and what the challenges might be and the additional challenges in this new environment that we face now for the coming months and potentially years to come. So what are our current top risks and threats? Well, of course, we know right now what our current threats.
Suzanne, I just interrupted. Yes. We can't see your screen yet, so if you could share your screen, that would be great.
How is that happening? So let's see. Can you send me a screen? I'm not seeing where.
It does say that you are.
Okay, so click to start screen sharing. Thank you for that.
There you
Let's
go.
see. Can people see now?
We can. Thank you.
Great. Perfect. I am so sorry about that. My apologies, everyone. All right, so let's go back and, like I said, it's all about COVID-19 right now, but we need to still be thinking about what are the top risks and threats that are still out there. And so here are some of them. And let's take a look. We're going to take a deeper dive into some of these, specifically on the crisis communications challenges and how we need to be still thinking about these, and maybe how we need to adapt our crisis communications plans now because of the new environment that we're in, pandemic-related as well. So let's look at one of the ones that we highlighted, and we know that we're experiencing it right now. If I put this slide up, and I did put this slide up several months ago in other previous presentations, and a lot of communities would say, no, I don't think I live in a hot spot for civil unrest, but I think now we can all say that we all don't know and potentially could be. So we all need to be prepared and think about that happening. But it's not just something that's happening now. And I wanted to share a situation that I was involved in 10 years ago. And this might be something that looks like a recent photo, but I want to share with you that this photo was taken almost exactly 10 years ago. It was 10 years ago this month that we held the Toronto G20. And it was held in downtown Toronto. We had, at the time, I was part of the G20 planning team of critical infrastructure members who took months of planning to be able to help us plan on how we were going to support our critical infrastructure and business operations in the downtown core should protest activity during the G20 escalate. We had no idea whether it would. It never had before in the Toronto area. This we had never seen. It happened. We didn't know this would happen, but it happened. We had plans. We had planned months ahead of time for this potential of happening and different targets being targeted. However, we hadn't planned for what happened afterwards. And this is what I want to share with you all as businesses, because you might not think right now, well, perhaps some of the protest activity are not in my area or they don't affect me, but here is what might still happen as well and what we faced 10 years ago. As I said, I was working at the time for critical infrastructure. We were the major power provider for the city of Toronto. And a couple of weeks after we had dealt with the actual initial G20 protest activity, there was a call to protest and gather outside of the Toronto Police headquarters. And this was to protest what was deemed as unfair arrest practices of the police during the G20 summit arrests. And so a couple of weeks later, there's a protest that's promoted, and very limited amount of time that we have warning about it. It ends up our headquarters with our leadership team, our senior management, our operational team was right across the street from the Toronto Police headquarters. So we find out about an hour and a half beforehand from social media that this is happening. There's a call for protest outside of the Toronto Police headquarters. Immediately, we realized we have to notify our staff to let them know, one, that this is happening, but we also have to let them know what options they have. So right away, we assembled the emergency operations team, the crisis management team, and we talked about it, and we realized we had to communicate right away because now this was out on social media, and gave our staff options, including considering sheltering in place. And we gave them the opportunity to do so and told them where they could assemble to shelter in place until they felt it was safe to be able to exit the building. It was entering around the end of shift time as well, where a lot of people were leaving. And so we had suggested if people wanted to leave early to avoid the potential of protest activity within a couple of hours, we gave them that choice to do so. We also advised them to take the back door. We also advised them not to confront, or if they were confronted by protesters, to talk to them and just to maintain their safety. We also provided escort assistance if people didn't feel safe and still needed to get home or to their vehicle and didn't feel safe to do so on their own. So just some things that you may run into that we had to consider that we had not thought of in this larger scheme of the big critical infrastructure planning team for that G20. And of course, cyber, we know that cyber attacks are still happening. And if anything, the cyber hackers are taking advantage of this very time that we're in and the additional vulnerabilities that we have now. So now more than ever, it's important to remind our employees and communicate to them to be super vigilant and to remain vigilant, whether that they're at home or they're back in the office or wherever they are, to remember to keep that vigilance, that hackers are out there, and not to open anything, not to forward things that look suspicious, and to maybe just train people again on reminding them of that and remembering that things are still happening. They're going to keep happening. You don't want to be taking down either your community or your company, as we've seen happen on this slide, and others where the cyber terrorists take control. And then that becomes the message in the media as opposed to you controlling it. So be aware of that. And again, the best way that you can try to prevent those things from happening is to be able to communicate to your employees and make them part of the vigilance team to not bring in cybercrime. And of course, terrorism. And I mentioned there are a lot of webinars out there. I had the good fortune of sitting on one a couple of weeks ago that Colin Powell was the guest speaker. And he reminded people that there's still terrorism, of course, out there as well. There's still terrorism activity. We need to be vigilant again and remind ourselves that that is something as well. I'm not saying necessarily it means that every company needs to have a terrorism plan in place, but we need to be reminded that this is still things that are happening and could still continue to happen whether or not we're in a pandemic situation or not. Speaking of which, active shooters, workplace violence incidents, active intruder attacks, those things are going to keep happening as well, unfortunately, and we've seen them increase. And while I know that I believe a lot of communities might be thinking, well, because we're potentially decreasing our workplaces and going more remote, that we may have less workplace violence incidents, but in fact, I believe we're going to see the exact opposite, because as things progress and time goes on and mental health issues appear, financial issues appear, there are going to be so many other triggers and stressors that are going to contribute to potential factors that may disrupt people and their environments. And of course, there still are workplaces. We're always going to have workplaces. As long as we have workplaces, we need to make sure that we're prepared for the potential of workplace violence activities as well, not just in the workplace, but how you handle them if your employees might be affected. And I want to give this example. So obviously, most of us remember what happened in Las Vegas a couple of years ago. We won't be seeing that scenario anytime soon as far as large-scale concert gatherings in an outdoor or indoor venue. But I want to use this as an example for a second. Let's take a look at all of the different impacts or people and areas that might be impacted by an event like that, and not just Las Vegas, and not just the concert organizers or the people that attended that concert, and specifically from a crisis communications perspective. So here's some things to think about. What would you communicate if you were the hotel where that occurred, the city of Las Vegas, the concert organizer, the promoters, or what about you're an employer to one of the victims? And I think a lot of us now, we're at a point that most of us knew someone who was at that concert. And that means that everybody there who was either a victim or somebody who was injured or directly impacted had an employer, potentially, somewhere else. And you remember hearing that a lot of people weren't from Las Vegas, weren't even from the state of Nevada. So that's another issue, is there are a lot of other states that were affected, employers and communities that had somebody or groups of people who were affected. Would you choose as an employer to communicate to your employees about this or to the public if you had one of your employees affected by this? And then also, if you were the person or the shop that sold the perpetrator the weapons. And so I'll share with you, I won't read it, but you can take a bit of time to read what the Guns and Guitars owner said in a statement. And I believe it was important for some kind of a statement to be made. And this is the one that they released. Whether or not you think that this was appropriate, I believe it was appropriately worded for something that they had to acknowledge and recognize and make a statement on. And on active shooter attacks, just another personal observation that I wanted to share with you from a connection that I have made and had the good fortune of having a friendship with the former manager of Pulse nightclub in Orlando after the shooting there. And one word of advice that he has for everybody out there is that Facebook and Twitter were key. For him, while that active shooter attack was happening, he was and had people managing social media to be able to advise them to stay away and alert them as the crisis was unfolding. So I wanted to be able to share that with all of you as well, to remember the value of social media in effective communications immediately to potentially be able to save lives ahead of time. And now let's get into San Bernardino, California. And I have a special connection to San Bernardino because I've been working with the survivors on lessons learned from their perspective on how we can do better as communities on helping them recover and helping workplaces and communities plan better for how we respond to and recover from workplace violence incidents like this one. So you might remember it was a workplace violence and active shooter / terror attack all rolled into one in 2015, which resulted in the death of 14 staff members of the San Bernardino County of Public Health. And they were mostly all public health inspectors that are at an off-site location in a conference that day. But I want to share with you some of the lessons learned, and specifically thinking about it from a crisis communications perspective. I mentioned this was unlike a lot of active intruder attacks. This was a multi-level attack incident all rolled into one. There was an issue that arose, which apparently HR had been advised of. So there was a communication to colleagues about a concern of this colleague who ended up being the perpetrator of this attack, and that there was a lack of communications potentially from that. And we will see some fallout from that and litigation from that as well. We'll get into that in a bit. The challenge as well, this was an incident that was off-site, as opposed to people might be familiar with what to do, and you've communicated that effectively to your staff regularly as far as what to do in the case of that kind of an attack in your own workplace. But remember, if you're going off-site, you'll need to remember to communicate that to your staff as well. What are the expectations, and how are you going to properly evacuate should something happen at an off-site location? And then what came out constantly through my communications with the survivors was the need for better communications and the lack of appropriate communications, or their feeling of a lack of communications between the employer and themselves throughout the immediate and long-term recovery process. So that's really an important lesson to remember. And just these are some of the impacts. Now we're going on almost 5 years later. And here are some of the key impacts. But I can tell you, if we look at each one of these points, each one of them could possibly have been solved by, or potentially not even appear with proper communications ahead of time. You might have been able to not lose some of the employees who now lost trust in you or the organization and now are never going to return to work. That community ripple effect that happens because of it. And now we're seeing secondary trauma and deaths as a result of perhaps not being able to deal with their mental health challenges appropriately and not knowing where to go to be able to provide assistance. And of course, the reputational damage, which is huge, and we need to think about that. We're going to talk a lot more about reputational crises as well, and how we need to think about that more with the era of social media as well. And then litigation. As I mentioned, the issue of communications and communicating ahead of time concerns of a potential employee, what would have happened if potentially that would have been resolved ahead of time. I have no idea what happened behind the scenes, but I wanted to share some of these insights with you. And in the end, just remember to communicate with your staff, and remind them of all the different ways that you're going to notify them and how you're going to train them ahead of time and make them aware of what appropriate things to do in the case of an active intruder attack or workplace violence attack. And now let's get into severe weather. We know, and we're starting to face now, these severe weather issues that are happening because tornado season, hurricane season are here or quickly approaching. And in Canada, we're seeing forest fire and flooding season, and across the world, we're continuing to see severe weather events. We're going to continue to see them throughout the pandemic as well, which is an additional challenge for us. We now have to think about how are we going to navigate through responding to these kinds of events, whether they're natural or man-made, in a pandemic scenario as well. So it's time to really, if you haven't already, pull out those crisis communications plans and look at them from a pandemic lens now, but also how you'd be able to respond to anything else in this new reality. But reminding ourselves that these are still going to happen, they're happening around the world. Some key communications challenges in these kinds of situations, specifically if we're talking about mass fires or mass outages, you're looking at extended power outages. We need to keep being aware of that. Now we're going to a lot of technology-based solutions for the short and long term throughout the pandemic, which is great, and we need to continue to do that. But we also need to know that the more reliant we are on technology, the more vulnerable we are as well. So we need to still have those backup plans in place now more than ever, because our critical infrastructure will continue to be vulnerable as well throughout this pandemic. We may be forced to go back to old school methods as we see, and we've seen the last couple of years as we see extended power outages and cell phone towers connections being lost as well. So just assume you will lose primary communications for an extended period of time during this kind of a disaster. Have those backups in place and test them if you haven't for a while. And encourage now your employees and their family to have the things that to make sure that they're prepared for an extended power outage within their own homes as well. Because, of course, the more prepared they are at home, the more they'll be prepared to be able to continue to work and support your critical operations as well. And we saw just an example of people were going back to the old school technology, things that used to be on our crisis communications plans and our crisis management plans years ago. And now we're going back to them. We're going back to ham operators, and so if you took them out of your plans, you might want to put them back into your crisis communications plans. Ham radio operators and your local radio stations, those kinds of things. Make sure that you're going back to those places and taking a look again at what's out there and what's available as alternative options throughout the short and long term. Here is an image. Sorry, I'll go back to that. Here's an image now of the California campfire. And there were quite a few communications lessons learned from that I wanted to share with us all as well that we could take away. Now, the community of Paradise had an emergency notification system set up, which was great. And hopefully most communities, if not all, have this kind of a system set up. However, the way they had set it up originally was it was a voluntary opt-in, meaning you had to go in and sign up to receive alerts. And we all know the effort that it takes to do that. Realistically, it makes sense that only about a quarter of the residents opted in. You want to make it that instead it's more voluntary opt-out instead, because then you're getting more buy-in, obviously. And I think if they would have gone that route, and they realized that, if they would have gone that route, they would have had a lot more people notified and who would have been on that system. So the self-service for both providers was lost around 10:15. Evacuation orders were issued between 8:03 and 1:37. And like I said, there were a lot of people who missed that notification or those orders because they weren't registered to receive alerts. So a couple of key recommendations, of course, is make it opting out as opposed to voluntary opting in, and think about maybe in other options, audible alarms, sirens with lights, universal mobile alerts, different things to be able to add on to make sure that you can try to communicate to as many people in as many ways as possible. And then considering alternate communication strategies and vehicles if you need them. Now, just because the river is quiet, I love this Malay proverb, and I've been using this for a while. This was pre this pandemic. I've been going around and putting this slide up and letting people know that, keep in mind that even though we don't have any infectious disease outbreak or epidemic or pandemic right now, you never know when something's going to happen. And of course now we are in what we're in. But I want to remind everybody that we still do have other things out there that might potentially lead to other outbreaks or epidemics as well. And we need to be thinking about that as well. It's not just about pandemic, and it's not just about COVID-19. It's about all sorts of infectious diseases that are out there that we also need to be aware of and be prepared for. And it might not affect all of your community. It might not affect all of your country. It may just be a localized outbreak that affects your company or one of your areas within your office building. So just a reminder of the terminology as well, that right now we're in the middle of a pandemic, which of course we know the definition of a pandemic now, I think, very well, but reminding people about epidemics as well. They're still out there. We had a SARS epidemic. I'll talk about that in a bit, a couple of lessons learned from that. So SARS, just for everybody who was not aware of, that was severe acute respiratory syndrome that we faced in Toronto and several epidemic areas across the world in 2003, but it was never actually a pandemic. And then there's outbreak situations where we're seeing localized measles outbreaks, a lot more of those, and I'll get into a little bit more of that as well. So let's just keep in mind the different types of threats that are still out there from an infectious disease perspective. And we go back to, of course, 1918 and the influenza pandemic, the Spanish influenza that we all faced. And the lessons that we learned from then, we can continue to learn. And it really is all about how we communicate to our communities and ensure that they enact social distancing, good social distancing practices. And this is just an example of the difference between two communities who one chose to have a parade after the first wave was over, and the other did not and continued to implement social distancing. And we see the difference in the spike of cases. And now you're hearing in the media reports that the second wave during that 1918 pandemic was much larger than the first. And we really have to be careful of that. And we're witnessing that in certain areas of the globe right now. We still need to let's learn from history and realize and recognize that this happened, and we don't want that to happen again. We don't want to see the secondary or the third waves or however many waves we see in the future be worse than what we've faced for the first wave or second. So it's so important for us to keep communicating that message of implementing good, safe social distancing and common health care practices to our employees throughout. So here's some of the common COVID-19 communications challenges that I've been witnessing, and I think we've all been witnessing throughout the last few months now. And of course, it's because this is such a fluid situation, as we all know, and it's so new. We keep talking about it being a novel coronavirus, which, of course, we all know just means it's new and it's never been experienced before. No one has immunity to it. It's very severe. It's like nothing we've seen before, and frankly, it's like nothing we planned before. We spent 18 years, a lot of us, planning after SARS happened in Toronto for what we thought would be the next global pandemic, and yet we still didn't have these types of assumptions that we're facing now. So we're seeing mixed messaging from various levels of government and leadership as things are changing and as policies and procedures and orders are varying from state to country to city even. Because of that, that's challenging for people. They don't know which messaging to follow and where to go, and people are going to Google, maybe not getting the right facts or information from there. We see the facts are changing daily. Sometimes they're changing multiple times a day. You're seeing probably multiple press conferences happening from multiple leaders and with different messages. It's very confusing for the public as well. These are unprecedented times, and like I said, we're breaking previous pandemic assumptions that we made as pandemic planners in the past, where we didn't really think about masks or no masks being an issue. But that now, of course, we've seen that being a huge issue and a communications challenge as well, and the change of direction that the CDC and others had to make because of now recognizing that the virus can be transmitted while people are asymptomatic or pre-symptomatic, which was very different than the regular influenza or even SARS, which you could be contagious just a few days before showing symptoms, as opposed to this one where you could be for several days or, never show symptoms at all and still be infectious. And so the change in direction of the mask, do you wear a mask? Don't you wear a mask? Why are you wearing a mask? Why are you not wearing a mask? I think it's really important for us as employers to be able to communicate and just explain to people so they're not searching online and might be getting direction from unofficial sources. So whatever you've decided as a policy to whether you're going to implement mask wearing or promoting or not within the workplace or outside to your employees, let them know what that is and why, and explain to them the fact that it's about protecting others and potentially avoiding the spread because people don't know that they might be spreading it, as opposed to it being a safety measure where it's being used to block out the virus, which is not the case, as I think we all know now, and it's been explained by our health authorities. But I think it's something that still just needs to be repeated. People need to be reminded of. Then the lockdown and shutdown communications, huge issues as well. How do you communicate this kind of an extremely sensitive issue that has privacy implications with it as well? So again, take a look at your crisis communications plans. What do they look like now? And do you have plans in place on how you're going to communicate to people and your clients potentially if and when this happens and you need to respond? You're going to have internal outbreaks. If you don't have internal outbreaks, as I said, anybody who's going to open up again, potentially not at home if you're working remotely, but plan for the potential of internal outbreaks as you're opening things back up again. Or, if not, the potential for outbreaks or the rumors of outbreaks, because how you communicate with a rumor of an outbreak may be just as important as how you communicate during an actual outbreak, if one actually happened. So be sure to think about that as well and prepare ahead of time for that if you haven't already. Your spokespersons and your trusted sources. It's time now to take a look again at who those are, who you identified, and are they the right people to be trusted in this situation? I really think it's time that people take a look at making sure that we have the right people and the right spokespeople that can be trusted sources of information to be able to look to. What's social distancing? It's huge as well. I mean, everybody's asking, well, what is it, 2 meters versus is it 6 feet? Is it 6 feet plus? I think it's 7 feet. Is it 10 feet to be safe? And I mean, that's a challenge as well. So it all depends on how you choose to communicate, but go with the guidance that is coming directly from our public health authorities. And keep directing your employees back to your public health authorities. And it avoids you creating a bunch of, information for them. There's a lot of great information out there that's already been created by FEMA, by CDC, by a lot of different resources. Steer them to those official sources for the right information on what to do and how to plan accordingly. And then also direct them to those areas to address rumors and misinformation. If you can be able to steer them to the right official sources, then you may potentially be able to avoid the spread of misinformation and rumors within your workplace, which then alleviates some of the fear that could also potentially cause and increase rumors and crises from happening within your workplace. Think about, this is something I just want to remind people of, there are other things out there as well that we need to plan for and that are still happening. We've got regular flu season that's still going to happen while COVID's happening as well. H5N1, the original bird flu, that's still out there. It's not that much of a concern right now, but it's there. That's the one that we were all really planning for back in 2005, that we thought that was going to be the big pandemic. It's still out there, though, as a virus. And then measles, that's a big one. I'll talk a little bit more in detail about that. We've seen mumps outbreaks, Ebola in certain areas of the world, the Middle East respiratory syndrome, similar to SARS, what we experienced in Toronto, that mostly contained within the Middle East, but is a coronavirus that is of concern as being watched as well. And we obviously are seeing new and emerging viral threats, like the one that we are in the middle of now, which we had no idea we were going to be in a few months ago. But I'll go back to measles for a second, because I think this is the one we really need to be thinking about and need to be aware of. We were already seeing pre-pandemic the largest measles numbers and outbreaks we've seen since we thought measles was eradicated 20 years ago, and for a number of issues, including the anti-vaccination movement. But now we really need to think about, there's a lot of people who potentially have not been getting their kids vaccinated throughout this pandemic period, either because they have not been able to access their medical providers, they don't want to, they are going to continue to fear to or not want to, be vulnerable to do that. Because of that, I think we are going to continue to see, and we need to plan for an increased possibility of us seeing measles outbreaks within your workplace. And why I'm very fearful of measles is because it's how contagious is it? We're already seeing how contagious this virus is, but just a reminder of how contagious measles is. It's highly contagious as well. It's both airborne and droplet-based. Look at how many people are infected by a carrier typically. Huge compared to the number that are affected by the regular influenza. What do? We need to prevent the spread of measles by getting vaccinated. So this is something that we need to keep communicating and reminding people about. To remember, it's not just about the pandemic right now, but it's also about making sure that we keep up with our vaccinations to try to ensure that, or try to not have the potential for another outbreak within our pandemic. Nobody wants to see that. SARS, I mentioned, we saw and experienced the severe acute respiratory syndrome in Toronto in 2003. We had 44 deaths within a very, very short period of time before they were able to take control and knew what they were dealing with and be able to handle it accordingly. And just a couple of SARS lessons learned I wanted to share with people. And, I mean, we're going through it now. There's a lot of these things we are seeing and witnessing. Of course, our healthcare facilities and workers were most vulnerable. You're seeing that, and as well as our long-term care facilities. But new and emerging threats could take weeks or months to identify and eradicate. We saw that with SARS, it took a matter of days before we didn't have hardly any advance notice. That situation actually was hit us quite by surprise, just like this one. So, but there are others that give us a little bit more leeway. Let's make sure that we can plan accordingly for both. Those that catch us by surprise and those that we have a little bit of time for, like the ones that I've mentioned that we're continuously monitoring. And the quarantine and isolation issues, that's huge. For those who haven't had to experience that yet as an organization, think about the policies and your communications messaging that you need to develop if you need to think about making those kinds of decisions and how you're going to communicate that to staff ahead of time so that they're comfortable with those decisions. And if you've got a union environment, I highly advise you to involve your union in those discussions ahead of time so that they're in agreement of and make sure that everybody's on the same page is what that's going to be so that everybody is more accepting. Communicating with the public is key. We all know that. Here's just an example of what we had to do and realize we had to set up an instant hotline to be able to field all of these thousands of calls that were coming in on a daily basis. Of course, we all saw the huge financial impacts, and of course, everywhere is going to see that from this pandemic. And then just a reminder of H1N1. We had a pandemic, and it was in 2009. A lot of people don't even remember that it happened, but it did. And what happened was, I think it did us a big disservice in the business continuity profession, frankly, because once it happened, I saw a lot of people had some great plans in place. As I mentioned, the bird flu plans, that we had all developed, pandemic plans we'd all developed in response to that. Everybody pulled them out, did some great work in responding to H1N1. But I think because there were not so many deaths, it wasn't as big of an impact as, of course, we're feeling now. A lot of people felt like, oh, okay, well, that was the big pandemic that we were all planning for. That wasn't that big a deal. Okay, so I think a lot of people then kind of shelved their plans and thought, okay, well, we dealt with the pandemic. And one thought maybe that's it for the next century. And also, well, we dealt with it, okay, so the next one that comes, we'll just pull out this plan again and we'll deal with it again. However, now we realize that we needed to be on top of those plans, potentially a bit better, some of us anyway. And so some of the communications lessons learned that we had from H1N1, and where I worked at the time, and we were workplace safety. That was what we were all about, a government agency responsible for worker safety. And we had an outbreak internally. But some of the lessons learned that we had, just to offer some guidance for all of you returning to work as well, review your plans and anything that talks about World Health Organization phases or pandemic phases, because it may not be appropriate or applicable. You need to think about infectious disease plans. It's not about pandemic plans, even though we're in the middle of a pandemic right now. Like I said, we could be prone to any kind of outbreak or epidemic as well. So keep that in mind. It's not about potentially what's happening globally, but it's about what could happen locally and how you're going to respond effectively. Screening of employees may not prevent the spread, and I'm going to keep reemphasizing that. For those of you that are thinking about doing temperature checks and screening of people before they come in, we do know that there are a number of people who are not going to show symptoms, who are not going to have temperatures. Because of that, you're guaranteed that you're probably going to miss at least 40% of the people who might be carriers of the virus. So just caution on thinking about whether or not you're going to implement that. If you do, I would suggest you implement that with a number of other measures as well, and also communicate with people ahead of time that this doesn't reduce and eliminate the risk of our spread, because I want us to be aware of not giving a false sense of security by these types of decisions that we make, by thinking that people see that the temperatures are being checked and then that means that they're safe. And obviously we know that's not the case. We need to communicate that with our staff if you're going to be implementing those kinds of things. We saw social distancing does work, so think about how you're going to be reconfiguring your workspace and your workforce as a result of it, but also re-communicating that message to your staff constantly and promoting that messaging to them at all times. And H1N1 challenged previous assumptions. So that virus started in North America, not Asia. And within a matter of days, it went from Mexico to where we were in in Toronto, Canada. And we saw that most people had mild or moderate symptoms in most areas, and that could happen as well. Well, communication is key, educating people ahead of time, and now educating people now on all of these. And I know we're doing that right now with COVID, but we also need to remind people about all of the other risks, and it's about infectious diseases overall. Some of our HR communications considerations that I'm seeing that I wanted to remind people about as well. Sick time and vacation time, all of these different things are going to have to be reconsidered, and you're going to have to communicate that to your staff ahead of time in case, if you're encouraging your staff to stay home to prevent the spread, but then they don't want to exhaust their sick time or their vacation time. And remember, people get sick of other things. People need to take time off because their children are getting sick or whatever it is. We're going to have to come up with creative solutions, and we need to communicate what those creative solutions are that we're providing to our staff to accommodate so that we potentially can avoid bringing in outbreaks within our own workplaces. Make sure that we've got those revised policies and procedures in place throughout the pandemic, and maybe they need to be revised for the long term, and they make sense overall. Let's take this time now to think about it. And looking at the long term, I think now that we know that we're in this for the longer term, a lot of people are going to be working remotely for a long time, if not for the rest of their work life. Well, looking at some of the safety issues from working from home now as well. Physical safety, but as well as ergonomics, which, you didn't think of at the height of the pandemic, but now that things are getting, more back to a new normal, we're going to have to be thinking about that as well. How are we equipping people? Maybe think about how you're going to communicate to staff about that, and maybe have some online, Zoom sessions on how to be able to check your ergonomics and all these different things that we need to be thinking about still. And the shift in the concept of work-life balance, that went completely out the window from a few months ago, where we were really thinking about making sure that people, shut down at 5 p.m. and once you're out of the office, that you shut off your phone and don't check your emails. Well, of course, now it's the opposite. We need to make sure that we can accommodate for all of these different types of shifts and different types of concepts of work and combinations of working from home and working in a workplace and staggered shifts and people working certain days and not on others. How are you going to keep the communications with your colleagues that way as well? So another challenge that we're facing, but some opportunities to come up with some really great long-term solutions that will end up being great for your company, your company's resilience, as well as your employees' long-term resilience as well. Another communications consideration for people, though, Zoom fatigue. This is something I keep hearing about, and I mean, we're all witnessing it right now. We're in a webinar, but specifically when companies are now doing all sorts of Zoom meetings, and I caution people about Zoom fatigue and just over-Zooming, because everybody is now feeling like they have to be on all the time and the camera's on, where before at least I think that people need to find a healthy balance in communicating, by not just thinking it always has to be about visually seeing people. Maybe we pick up the phone sometimes and just talk to people that way. And people aren't so stressed out about having to look on all the time and be ready. And then the next Zoom call is an hour from now. And, and their background is okay, and that they're not worried about their kids, running in the background. All of these things are contributing factors that we really need to be aware of now that we're in it for the long term. And then, of course, the privacy issue. If and when you're going to see outbreaks happening within your workforce, how you're going to communicate that, keeping in mind the privacy issues involved, and how we can use this opportunity, though, to build back better after coronavirus, and thinking about those issues of working from home, and then reviewing our crisis communications plans now and training people appropriately, and looking at, here's a creative solution, employee assistance programs. Here's another area to think about, and this is what we thought about back when I was working for the Worker Safety Agency in the government for pandemic planning, was we were realizing, whoa, if we're in the middle of a heightened pandemic that everybody else is experiencing the same thing, there's only a few major EAP providers out there. We all go to the same EAP provider. Well, they're all going to go to them. They're going to be exhausted, and we're going to deplete their resources. And plus, they might have a number of their staff that are taken down for a period of time as well. Who are we going to go to? So they came up with an amazing creative solution of creating peer support teams, where volunteer staff were trained to be able to provide just that first connection, to be able to then act as a resource, a trusted colleague resource that people could turn to, and then they would be able to advise them on where to go. And they had the links and resources to be able to give to them, as opposed to them being the actual EAP provider. They were the link, the connection between. And I think it's a brilliant idea that potentially people could enact within their own workplaces during COVID as people recover. If you take that opportunity. If you have staff who have had COVID and are recovering from it and returning to work, potentially they might want to volunteer and share their knowledge and be a disaster hero by sharing what they can and being a guide and a friendly voice of support for your employees that might be concerned or might have heard rumors or whatever it is, or going through the same thing. Think about maybe considering something like that. And I mentioned planning for the potential of increased workplace violence and incidents, and how you're going to make sure that you provide a venue and an opportunity for people to feel safe in having a staff person that they can communicate to and report concerns to if they have concerns of an employee that they need addressed. And is it the right person? Now is the time to think about that too. You might have that in place. Is it the right person that people would feel comfortable in communicating that to, and feel that their issue is being heard and acted upon? Now let's get into reputation. I mentioned let's turn this crisis and any crisis into an opportunity, and look at how we were able to respond and recover from it. And just a reminder for people, there are apparently now more people out there that own a cell phone than a toothbrush. I'm hoping that everybody who's listening has both of them. And just on that note of toothbrushes, a reminder as well on social media. Once something's out there, you can't reel it back in. So watch what you're putting out there technologically. We've seen issues of, unfortunately, mistakes happening due to technological tools now that we have, with Hawaii a couple of years ago, and a message of alert that went out and panicked a lot of the community there. And they had to come up with creative solutions on how to communicate quickly that was a false alert. We had the same thing happen here in Canada recently at a nuclear generating station, where a false alert went out and panicked a lot of people. And I wanted to just share with you as well to watch what we type, because sometimes it's hard to watch, and especially with numbers, and if we're doing 1-800 numbers, watch what you're typing and make sure it's the right number. Cautionary tale here from FEMA Region 4. After Hurricane Irma, they tweeted out this helpful tweet of this 1-800 number for people who needed damage help. However, unfortunately, somebody who was following them corrected them and tried to call that number, and ended up it was the wrong number, and ended up being a different kind of hotline. And as a result of that, this became the headline, unfortunately, the next day for FEMA, instead of, FEMA does, release this great hotline, and here's all the great work that Roof Blue are doing. So just a cautionary tale there, and that reminder that even if you delete a tweet, it's still out there, and it could have been screenshot and forwarded and retweeted to a number of people and saved. So a reminder to everybody, watch what you put out there electronically, and just think about it as though it could just be plastered on the news or on the front page of a newspaper, or just broadcast live anywhere you want. And I'm going to give an example now of something that we faced here. You may recognize this gentleman, the former mayor of the city of Toronto, who unfortunately passed away a few years ago. But I want to just use this as an example for people to just really be aware of the challenges now today that leaders have, and we all have, with social media and everybody being an iReporter and having access to a video camera capability on their phone and the ability to catch anybody off guard without your knowledge and knowing it. So be aware not only of that possibility of happening, and that people are going to want to target people, and that be careful of the actions that you take, and remind your leadership of this. Remind all of your staff of this, because you would never want this to happen to you and potentially take down your leader, your employee, or potentially your company or your community or their reputation because of it. Unfortunately, for a number of months while this was happening and this video came out of apparently our mayor at the time doing illegal activity, and it was pushed out to everybody, that became the story everywhere across the globe, as opposed to the excellent work that our city was doing on everything, on crime, and all of these incredible achievements that we should have been communicating on. We spent a lot of time just responding to criticisms from these images. A huge reminder of what we are in now and how that impacts us, and how that it could impact our reputation, and the need for us to remind all of our staff to be vigilant. And a reminder, we have three choices when something happens. It defines us, it can destroy us, or it strengthens us. And I think we've all seen examples of organizations that have gone through and made different choices, and different things have happened because of it. And now with social media, our reputation can be damaged within the period of 1 minute as opposed to 1 hour, as we see in this Japanese proverb. And I'll just give an example before we start closing this up, of an image that some of you might recognize from a United Airlines incident that happened a couple of years ago with the doctor that was dragged off the plane. A reminder again, somebody caught that. Several people caught that on camera. That became what was the headline when you typed in United Airlines. This became the face. This gentleman with the glasses being dragged became the face, as opposed to who you see in the inset picture, who was the former CEO of United Airlines, who should have been the face of positivity and giving a good crisis communications messaging on behalf of United Airlines in response. However, that did not happen, and this became the image for 7 days, and that's kind of unheard of these days in the media for something to keep being repeated for that long. But it was, instead of this gentleman's image that was associated with a negative comment instead, which again, the CEO or former CEO of United Airlines. So just a reminder for people, how do people trust us, and how can we successfully communicate to our employees and our communities? It's all about gaining credibility and trust. How do you gain credibility? Be accurate with your information, be speedy and timely with it, be the first one to give the accurate information to people, and then be trustworthy. Show that you're showing empathy, that you're feeling for people, and you're being open. That will display trust. If you show both of those things, you're going to achieve successful communications. Use this opportunity and any opportunity in a crisis to build back better. I love that term. Let's keep using that term to turn our crises into opportunities. Use it as an opportunity to build or potentially rebuild your brand. Think about now, do you have the right leadership in place who are respected and trusted? And if not, perhaps this is the time to maybe make a change on your leadership or your spokespersons. And also, if not, maybe this is the time to retrain them to make sure that they are the right people to communicate during a crisis. Are there other tools now that we can use because of what we're in that we can adopt within our crisis communications plans? And technology, of course, as well. Keeping in mind that technology also has failures with it. So to summarize, a crisis can happen anytime in the middle of a crisis like the one we're in as well. Let's keep planning for our top hazards and risks. If we don't have the proper crisis comms plans right now in place to deal with that, make sure that you're looking right now to see that that happens. And then now I am going to
Suzanne,
turn it over.
Can you go back one slide? I have a couple of questions I wanted to ask.
Sure.
First thing is that when you were mentioning about having people who are recovering from COVID-19, sharing that information with their, who they work with and being able to share their experience. One of the comments was that in some areas, people who would share this are stigmatized.
Right.
People don't want to be near them. So how might a company address managing that aspect of this, which I actually hadn't even considered. So thank you for asking that.
Yeah, that's a great question. And it's all back to effective crisis communications. So it's all about how you're able to communicate to your staff ahead of time what the realities are. And so then you're hopefully alleviating concerns and that stigma associated with it. Because we all know that people shouldn't have to be afraid of people who have had COVID and are recovering from it. And if you're
especially
doing
if they've recovered from it, they're not sick anymore. I can see where people would be concerned. In fact, this was a case where my daughter was working. She works at a food manufacturing plant. One of my kids does, and there were people at work sick, and they were on the news, and that actually is what changed things. But the fact is that once you've been sick and you've recovered, it's hard for me to understand why there'd be a stigma for that. And so that's something that companies are going to need to consider, is people being afraid of other people. And even once the virus is gone, how can they make sure that people feel comfortable coming to work and they're not afraid to come to work?
Right, and it's all about communicating how you're doing everything that you can to ensure their safety and directing people to the right resources so that they have the right and correct information. Yeah.
Another question that came in was about the fact that when people are working remotely, communications have changed. So that things that what people are finding is that you talked about Zoom fatigue, but the need to actually communicate more than you would if you were all on site, where you can do more maybe unofficial communications. And people, we used to say, standing around the water cooler or the coffee pot or whatever. The fact that the company is going to need to actually communicate more internally than they've probably ever done before about things. So that was that was kind of a comment question, which was that they're finding that the need to communicate is much greater than it is during, quote, normal times or business as usual.
Definitely. And I think it's now looking at all the different creative ways to be able to communicate.
Absolutely.
To get what we need out. So
thank you very much, Suzanne. Yeah. We've really appreciated having you speak today. We've learned a lot. And I just wanted to remind you that Suzanne is one of our great instructors. She teaches our crisis communication planner, our crisis management and communication professional, and we also have a 1-hour now version of crisis management communications at a high level. And these courses are available online, which we call live online. So you get a real instructor with real students. We just use our GoToWebinar feature for that, as well as you can study independently and take it via e-learning as well. So we hope you'll take advantage of that.
Yeah, we have one coming up June 22nd and 23rd if people actually want to sign up for the online one.
Absolutely. So we've been able to add some courses just because we can do them online. It makes it a little bit easier. Coming up in our webinar series in July, we have strategies to increase supply chain resilience. In August, we're going to be looking at the facility operations maturity model for data centers and how to implement that. In September, we're looking at, again, trying to be as agile as possible. So how do you do that into performance management, both for the individuals and the organization? In October, we're going to have another one of our instructors, Tom Serio, talk about crisis management. And in November, we're going to be sharing our organizational resilience capability model with you. So thank you all for attending. If you have questions for Suzanne, please feel free to contact her directly. Suzanne, do you have that slide where you could share your contact information?
Yes, I think it's up there. You do see it there?
I'm a little bit of a delay, so you can reach her by email, by telephone, and she's got her LinkedIn and Twitter there as well. So please feel free to contact her. And if you have any questions that you didn't ask during the webinar, you can go ahead and reply when you get your certificate of attendance and ask any questions then too, and we'll forward those to her as well. So thank you everyone for attending, and we hope you have a great rest of the week.
Thanks everyone. Stay safe.